So, welcome to week 2, where we're talking about healthcare, which, especially during a pandemic, is like the point of the spear when it comes to moral issues in our capitalist system. And so, what do I mean by that? Well, currently in our COVID-19 pandemic, our hospitals and healthcare providers are reaching the point in some places of critical standards of care. So what that means is they're going into crisis mode. They're starting to have to make really tough decisions as patients walk through the door or are brought through the door. They have to triage and they have to start doing things different than the way they normally would because of limited resources, staffing, machines, beds, all the resources that go into our healthcare system. Particular ones get strained, and right now, critical care, ICU beds, the staff. That's tough. That's a bad situation to be in, and it leads to some really thorny moral issues. So you have 2 patients come through the door, you've got 1 bed, you have to decide who to give that bed to, right? And so this is a classic setup for a class that talks about morality. There's a famous trolley problem where there's a trolley running down the tracks and you're standing next to a lever and you can decide whether to pull that lever or not. And if you don't pull the lever, the trolley's going to go and it's going to run over, say, 3 people who are on the tracks. If you do pull the lever, let's say it switches to a different track that has 1 person on it. So do you do nothing and have the trolley hit 3 people, or do you pull the lever and have it hit 1 person? It starts feeling thorny from a moral perspective because, well, you could save 2 people by pulling a lever. That seems like a great deal for thinking about deals, but we're not talking about deals. We're talking about people's lives. And so for that 1 person who's on the track, that if you pull the lever, they're going to get killed, you did an intentional act that you knew would kill them, that's when the law starts to say, it's starting to look like murder or reckless homicide at the very least, right? So our law reflects this moral feeling that a lot of us get that, man, if there's something we do on purpose, knowing it's going to kill someone, that really gives us pause, even if that thing may save some other lives. But so it gets tricky. That's the trolley problem. And it's often an academic exercise, but in this pandemic, we're actually at a place where there are people in our healthcare system who are starting to have to make tough choices. And so it's the point of the spear in the sense that we couldn't get a much more direct topic to talk about some of the moral issues that come up in a capitalist system, in an economy. Those same decisions get made whether you're in a capitalist system or not, as long as there are limited resources, and we live in a world of limited resources. But so the discussion this week, I'm asking you guys to think about that a little bit. I use an example that talks about a resource-intense procedure, ECMO, that's an advanced way of supporting people who are really sick, and it doesn't always work by any means, but there are quite a few times when you know the patient, you're quite sure the patient is not going to survive if they don't get on ECMO, and if they get on ECMO, they might have a 3rd chance or a 40% chance of living, something like that. So we're talking about probabilities. We don't know things for certain, but they're definitely at a stage with things like ECMO, advanced procedures like that, where they are making tough decisions. And so that's what I ask you to do in our discussion this week, thinking about how do we kind of weigh these decisions when there's lives at stake. And that's what happens in healthcare. So here we are, problems in real life, unfortunately, related to ICU beds and things like that. So I look forward to hearing what you guys think about these things. Some of you actually work in the healthcare industry. I'm especially interested in hearing your thoughts on some of this. So I look forward to seeing those discussions as we go forward. We'll have a couple other short videos. We'll talk a little bit more about our healthcare system, and we'll talk a little bit about putting that in kind of a context of capitalism versus socialism.